Coming up,
60% of that tooth is below the gum line. A lot of disease happens below the gum line.
dogs and cats need dental care too. Join us for a closer look at your canine's canines and learn how their oral health affects their overall health. This new Asian bistro has light, healthy, and indulgent dishes in an eclectic setting paying homage to a myriad of Asian cultures. Then Dr. SoFlo explains how to benefit from heat exposure ranging from a warm bath to the sauna. All that and more is today on SoFlo Health. Hello and welcome to SoFlo Health. I'm Hunter Frankie, and today we were gonna head to the beach, but it's just so hot outside. So instead, we came to WPLG Studios. We have air conditioning. And what better place to open up the Healthtionary? That's right, we're bringing it back. No better place. All right, we get it. Let's open up and see if we can find the first phrase for you to decipher and see if you know. This'll do. Synchronous diaphragmatic flutter with glottic closure. Before I tell you what it is, did you know that you're not the only one that needs to head to the dentist? Your dogs and cats also should pay a visit. And that's all they do over at Chomp. Here's more. You may not always be able to see what's going on with your dog or cat's health, but sometimes you can smell it. We're here at Chomp Pet Dental in Fort Lauderdale to learn a little bit more about dental health for your dog or cat, because that can actually be the cause of other disease they may be experiencing. But don't take my word for it. Let's go meet Dr. Andrew Heller in the back. This is Dr. Heller. He is the owner and medical director here at Chomp Dental, where we are today. And we've got some pretty cool stuff to show you if you're a pet lover, particularly dogs. That's what we're going over today, but also they take care of cats here as well. So
we do.
Doc, thanks for having us in. What are we looking at right here?
Well, it's great to have you. Thank you for being here.
Sure.
So this is a dog's skull, and I just had it here to show you that all dogs, whether they're little toy poodles or whether they're big Great Danes, they all have 42 teeth. It's pretty interesting when I show people, they go, wow, didn't realize that dogs have that many teeth, because humans have what, 30 teeth?
32? I think it's 32.
Okay,
Yeah.
And cats have 30 teeth. And that's why it's so important that your pets are seen by a veterinarian, and that we can get x-rays and look under the gum line, because a lot of disease happens below the gum line.
And here you're strictly pet dental.
Right.
Why did you choose to do just that versus general veterinarian?
I love it. I think that it's unfortunately one of the things that most pet parents don't think about that much. 80% of pets over the age of 3, dogs and cats alike, have some form of periodontal disease.
In fact, you have a patient being worked on back there who's having quite the day.
Quite the extensive
yes.
dental procedure, yes.
Now, somebody might see that your patient is under anesthesia and might be nervous about that. Why is that important for what you do?
Anesthesia is a tool. In the right hands, it is very safe. When we have pets under anesthesia, it allows us to go in here and actually chart and probe every single tooth. We're looking for pockets. We're looking for mobile teeth. You really can't do that with them awake.
Well, there's still a lot to learn, and particularly, I think once you see the inner workings of the teeth on an x-ray, which we're going to take a look at in just a moment, you'll really get a better idea of why this is so important and how this could prevent your pet from having some terrible health issues in the future. So keep watching SoFlo Health. We're going to head over to some x-rays and we'll see you in just a bit. Let's go. I'm once again joined by Dr. SoFlo. We're on the set of the SoFlo Longevity podcast, and you may notice that we are having a fireside chat in some form or another, and that's because today we're talking about heat. Dr. SoFlo, how is heat good for our health?
Heat therapy is one of maybe the most important things we can add to our regimen, not only for recovery and for, helping with certain disease states, but longevity in general.
And as a cardiologist, what is the mechanism that you observe being most beneficial to people?
To make it succinct, I can tell you that it really is sort of exercise without mobility. So you're increasing your blood flow to areas, your brain, your vital organs, by dilating the arteries at the same time you're turning on your heat shock proteins and all these molecular mechanisms that really help the body to be stronger, that only exercise can actually reproduce. And I'm not saying to do it instead of exercise, but I'm saying a lot of the value is very similar to that when we exercise.
What temperature do we start to get these benefits, or is there a temperature?
So if you look at the Finnish data, they use traditional saunas. So they use the kind of the rocks, that heat everything up in a room. And that really had to get to about 180 degrees. They had to be in it about 20 minutes, about 4 times a week. That was the sweet spot for most of the benefit. I'm talking reduced heart attacks, strokes, 40+% reduction in all-cause mortalities. That data really has not been seen. So that kind of temperature is one temperature. Then there's infrared data. Those infrared devices are kind of like, giving a particular sort of internal warmth. That is actually a lower temperature. That's about 140 degrees. And those actually take a bit longer. But the data suggests, particular for heart disease and heart failure, that those can be very, very beneficial. Then you have the third type, which is hot water immersion data. So what does that mean? Hot bath, a jacuzzi. The data on that is substantial. It's maybe the best data that we have that works kind of the quickest. But in my feeling and in my practice, I've recommended a little bit of each and what's most practical for people.
How can we make sure that we are doing this safely?
We are designed to have a little bit of a challenge. And the challenge of heat is scientifically proven. There are things we can follow, but absolutely, you got to talk to your doctor. And that's something that we've taken real seriously. And as you know, we have a book coming out in the fall about it. We really believe that this is one of the underserved, potentially free, useful thing that we can add to the playbook that we call, Best Health.
If you would like to learn more about how heat can affect their health, or find out when your book's coming out, how can they?
So www.SoFlo Longevity or SoFlo Health are 2 great websites that actually can point them in the right direction.
Yes, and I'm sure you'll have some discussions at length on your podcast.
Absolutely. Our SoFlo Longevity podcast drops every week, and hopefully everyone can have a listen while they're working out in the sauna.
Well, Dr. Sofer, thank you so much for your time. We appreciate you having here, and after all, Local 10 is now the home of the Miami Heat, so this fits right in.
How apropos.
Perfect. Thank you so much for your time.
Thank you.
More dental health for your furry friends is after the break on SoFlo Health. Welcome back to SoFlo Health. I'm Hunter Frankie, and we've been going through the Healthtionary today. And at the start of the show, I asked you if you knew what synchronous diaphragmatic flutter with glottic closure was. And if you said fluttering your eyes, you're wrong. Because it's actually the hiccups. Synchronous diaphragmatic flutter with glottic closure. The hiccups. All right, what else do we have here in the Healthtionary? Here's a good one. Let's see if you can tell me what coordinated oropharyngeal and esophageal deglutation is while we head back to Chomp. Real quick, how many teeth do dogs have? If you said 42, then congratulations, you were paying attention here earlier at Chomp Pet Dental. This is Dr. Andrew Heller if you weren't here with us earlier, and we're about to go over some x-rays to really show you why it's so important to pay attention to what's going on in your dog or cat's mouth. So, Doc, what do we got?
Yeah, so right over here, we're actually very fortunate that because all we do is dentistry, we've been able to invest in this really cool machine. It's called a panoramic dental x-ray machine. Basically, this allows us within 30 seconds to get a full dental picture of a dog's mouth. But what's really interesting to note here is that the teeth themselves are actually very healthy. But what we're seeing is bone loss, we're seeing periodontal ligament loss, and that is the definition of periodontal disease.
Right, so this is the real key. It's the bacteria in your pet's mouth that is finding a place to hide under the teeth, under the gums. Where is it hiding?
Yeah, so it starts out on the teeth,
okay.
Right? That's the brown stuff that most people are conscious of and they're aware of. But pretty quickly, it starts to go right underneath the gum line and start to eat away at the bone. Once it reaches a certain point, the only thing you can do, unfortunately, for periodontal disease is remove those bad teeth.
All right, well, we're going to now go take a moment and I'm gonna ask the doctor some questions that are probably burning in your mind to really find out what can you do, what happens after the fact, all the stuff that you need to know before having your pet's teeth cleaned and hopefully avoiding a situation like this. All right, let's head up. All right, let's wrap all of this up. I think the number one thing people might be considering right now is, well, how do I even know if I need dental care for my dogs or cat? So who is this for?
I would say if you have a dog or a cat, your pet needs dental care, period. For the large breeds, they're big chewers. I would say they're at high risk for tooth fractures, and then we have to deal with that. The small breeds are much more likely to get periodontal disease.
And what do you think that the major difference is? You kind of touched on it earlier, but maybe we make it clear here, versus doing what you're doing here at a specifically pet dental practice versus when people have their dog or cat's teeth cleaned, say at a groomer or somewhere else.
Yeah, so usually groomers are not vets. They're not using any type of anesthesia. And when you don't use anesthesia, really what you're doing is you're just making the teeth look white, you're making them look clean, but you're really not addressing any of the medical issue. You're really just doing a cosmetic cleaning, if you want to call it that.
Okay, and if people would like to find out more about any of this, how can they?
They can go to chomp.vet or chomppetdental.com.
Great, thank you so much for sharing. Is there anything else you'd like to add before I let you go?
I would just say thank you so much for coming and just helping educate the public.
You got it, thanks. Chances are that either you've experienced an injury, your friend has experienced an injury, or you've seen one play out on TV, and particularly when it comes to sports. They just lend themselves to things like overuse and freak accidents. So what do you do in a case like that? Well, you head somewhere like here, which is Mount Sinai Medical Center, and you see someone like Dr. Vance, who we're about to see. She is the director of sports medicine, and she wants you to stay healthy and recover quickly in the event of an injury. Dr. Vance, thanks for joining us.
Of course, happy to be here.
Oh, please. It's our pleasure to be here. And here in South Florida, people are playing sports, they're watching sports, and they're unfortunately experiencing injuries and watching athletes go through injuries, often that you are helping people navigate through. So what are some of those most common injuries that you see from people?
Yeah, the most common, I think, injuries we see are overuse injuries, right? So those are injuries caused by starting something too fast or increasing the intensity too quickly. That tends to be a lot of muscle strains, bursitis, for example, and those are often something we can treat readily in clinic. As far as injuries within a sports, like an acute sport injury, ACLs is one of the most common ones that we see. And we see, in the US alone, sees probably over 200,000.
One thing I think a lot of people always ask themselves is, when should I go get checked out? Like, I feel a twinge in the middle of my workout. Does that mean stop everything and go see a doctor? Does that mean just stop the workout for the day? Or does it mean work through the pain?
Yeah, so a lot of injuries we can work through, right? A lot of sorenesses we can work through. And if it's truly a soreness, you can work through that. You can take some rest, some time off, and work through. But if you have an acute injury, for example, if you hear a pop, a crack, if you have swelling in a joint that's not improving, that's really where you want to get it checked out. Or if you have an injury where you're like, wow, I can't keep playing, that's where you want to get it checked out.
And what are you doing differently here at Mount Sinai versus other places?
Yeah, I mean, I think we have an excellent orthopedic department. We're growing as we speak. All our surgeons are, I would say, on the younger or earlier aspect of the career, which is a benefit because we're all into the latest technology, we're all highly trained, and we're all eager to continue to grow this department into something spectacular.
Yeah.
We get along, we work together, we share patients, and we even often do complex surgeries together.
Yeah, you're able to stand on the shoulders of giants from everybody that's been putting those practices that you still follow into place, but also having the advantage of seeing what's new and being able to put them in place as well.
Exactly.
And in terms of that technology, what are some of the technology that you're using and how is it beneficial?
Yeah, so one of the things that I'm doing, you know, we're, again, talking a lot about ACL is recently we've been incorporating doing ACL repair with a bare implant, which is a newer technology that's been around for the last, 2 years, although the research has been extensive on it for probably over the last 30 years. The gold standard has been traditionally to take tissue from somewhere else, either yourself or a cadaver, and recreate the ACL. But with this new technology, we're able to use the tissue that you have left and repair it, and then wrap a collagen-based implant around it to promote it to heal.
Wow, that's really cool.
Yeah.
And if people would like to find out more about what you're doing here or get more information on this, how can they?
Yeah, they can go online to our website, and we have a lot of good information there.
Great. Dr. Vance, thank you so much for your time.
Of course.
come right back for an Asian bistro with a little something for everyone when SoFlo Health returns.
Hello, it's me, Hunter Frankie, here at WPLG Studios because it's way too hot to head out to the beach for us today. And what better place than to read the Healthtionary? Hey, we did that gag already. Welcome back to SoFlo Health. Did you figure out what coordinated oropharyngeal and esophageal deglutation is? If you said coughing, wrong again. Coordinated oropharyngeal and esophageal deglutation is just swallowing. But don't worry, I'm sure you'll get this next one. Audible borgamist caused by gastrointestinal peristalsis. I'll give you a hint. The entire crew got this over at Cho Funky Asian Bistro, where we're headed next. Ah, what the heck, I'll just tell you now. It's simply your stomach growling. But before I send you off to eat, I do have to leave you with one more word, or phrase really, from the Healthtionary. I have one. Paroxysmal involuntary nasopharyngeal expulsive reflex with coordinated diaphragmatic and intercostal contraction. Chew on that while we chew on this. We're at Cho Funky Asian Bistro in Miami Beach, and we're starting out in probably one of the coolest waiting areas I've been in a long time. They even have an old CRT TV here, giving homage to the fish tanks that you have in Asian markets. And it's also cool here. All right, I'm gonna go in the back. We're gonna find Mo and show you how it gets even cooler in an area of the restaurant that's not even technically for you, but it is for you. Come on, follow me. As promised, I went and found Mo. Mo, good to see you.
Good to see you too, man. Thanks for coming in.
Of course. I mean, we're actually back at house right now. This isn't really like their main restaurant. This is really cool. Tell me where we are right now.
Yeah, this is the back of house where all the food comes out from. We do have guests that like waltz in here to see where the food comes out from, like take pictures with the wall. So it's like super fun. We got like a lot of little surprises if you really look around.
Yeah, so it's functional, but it's also fun and cool as well.
Yeah,
and
it's
you can
great
see it from the
advertising.
street.
Everybody's always like stops and asks what's going on here, which is the whole point of the space, really.
Yeah, I want to know what's going on here, and I see you've got some food that's just coming out. So we'll head over to the dining room and then talk about it. Let's go. All right, we're at the table. Mo, now that we're here, we've got some food in front of us. Let's start with the food and then we'll talk about the space. So what am I looking at here?
So mango coconut salad, mango season, so local mango. Pad see ew, which is my favorite dish on the whole menu. Scallop crudo, it's a little bit of a play on tom kha gai, but you know, obviously it's scallops and colder. And then Vietnamese shrimp roll. Two sauces, peanut butter hoisin, nuoc cham.
Perfect. Well, I'm gonna break open some chopsticks here, get a bite. You feel free to join me. And while we taste here, tell me, about the space. I saw the really cool CRT in the front. You've got some great art along the way, and the whole restaurant, as you look around, you kind of discover something new. So what's the idea behind that?
The whole idea really is I wanted to put an equal emphasis on, the food, the drinks, the vibe, while still maintaining very reasonable pricing. I think that's what Miami needs right now. So it's like, build something for locals. How you like that? Definitely the best dish in the house, at least for
So
me.
full of flavor.
Wow. Yeah, it was great.
And it's got like a little crunch to it. It's a
little bit
cool.
of crunch, Chinese broccoli.
You have like a little spice in there, but not much. Just like a little something.
Yeah, I mean, a tiny bit, not too much. We kept the money. There's a couple spicy dishes, but for the most part, it's like light heat.
Yeah, when I say spice, more like a little like a twinge, like a little something to your palate. If people want to find out more, how can they?
Website, Cho Asian Bistro, Instagram as well, Cho Asian Bistro as well. I removed the funky just because it's too long for a website and Instagram. But,
yeah, you get the funky when you come in.
You get the funky when you come in.
Yeah.
You don't need to put it everywhere.
For sure. We've got a couple more bites here, and then we'll be over at the bar. Check out these drinks.
Awesome.
Thanks so much.
You're welcome.
Food was delicious. I went back for more while we were getting set up over here, but Fernando's here now, and we're gonna make some drinks that they have here at Cho Funky Asian Bistro. So, Fernando, what are we making?
All right, right now we're gonna be making the Neon Geisha.
Okay.
All right, it's a take on a whiskey sour, I would say. We use Suntory whiskey, which is a Japanese whiskey. We infuse it with some melon liqueur, some sweet honey, and it gives it like a nice citrus, I'd say tropical fruity flair.
What are you adding in there right now?
Honey, melon liqueur, and a little bit of a yuzu.
Nice. I guess this is what the neon is coming from.
Yes.
If you can't tell by the color it is. Wow. Beautiful. All right, well, we'll taste it, a little sip here. I like that it's got the honey as a part of it too, because, you know, often with liquor, there's, you know, simple syrup and it's just, you know, basically sugar. And honey is sugar, but I like that it's, you know, more natural form. Whoa.
It's good.
Whoa.
It's nice and smooth.
Yeah, beautiful, super smooth. It's creamy, and you can taste that like honey flavor that lingers after. It doesn't give you like that, when you have something sugary and you kind of feel like, I need some water, you don't need that here. It's nice and smooth. Well, Fernando, thanks so much, and thanks for having us at Cho Funky Asian Bistro.
Thank you.
Go figure, I didn't know that yoga could actually help with that too. Welcome back to SoFlo Health. I'm Hunter Frankie, and we've been going through the Healthtionary today. And before the break, I asked you if you could tell me what paroxysmal, involuntary, nasopharyngeal, expulsive reflux with coordinated diaphragmatic and intercostal contraction is. And if you said sneezing, you were finally correct. So give yourself a pat on the back and congratulate me for choking down all those words to say back to you. That's all we have for this week's episode of SoFlo Health. Thank you so much for watching. As always, if you'd like to watch previous episodes of SoFlo Health, you can do so on SoFloShows.com. You can also follow us using @SoFlo Health to share with us what you're doing to stay healthy. And from right here at WPLG Studios on the one and only Local 10, the local station, it's goodbye and good health.
This has been a presentation of WPLG Local 10, the leader in local programming.